Well, let's do it. Let's talk about it. Let's talk about it. You guys know that we've gotten to the point now where we can use lasers without a drill, without a shot. This is a
without motor.
Without motors. This is a laser right here.
Would it be okay if I recorded some of this for our interview?
Sure, you can.
Great, thank you.
And here we have a cavity that's it's called a class 5 cavity, and it's on the side of the tooth. And you can see the gentle pulsing of this erbium YAG laser. And what we're trying to do is remove the cavity without destroying the rest of the tooth like you would have to do with a regular drill.
Right.
This is more gentle. It's less traumatic to the tooth. It doesn't form any cracks like a regular drill would.
You save more of the enamel?
Save more of the enamel, so it's minimally invasive. That's the trend now, minimally invasive. It's selective. It can actually just remove just the decay without removing the tooth. You can see that here.
Yeah, that's amazing.
No shot, no drill.
You said like erbium?
It's an erbium YAG. Yeah, that's one of the types of lasers. There's different kinds of lasers, and to make it real simple, some lasers have a wavelength that's more absorbed in dentin and enamel, and others have a wavelength that's more absorbed in gum tissue.
For gum treatment.
Soft tissue. Hard tissue. This is hard tissue. So depending on the wavelength, we can selectively find a laser that will specifically achieve our objective without damaging the rest of the surrounding structures on the tooth. This is a special small gold-tipped spoon that we use to clean out. You see, when you're using laser, everything becomes real small, so you need special instruments to go in and clean things up. And that's what we're showing here. And then, of course, this tooth later is filled with a resin, and you can see it there.
Oh,
so
wow.
that whole thing was done probably in less than 3 minutes.
Are you serious?
Yeah, no shot, no drill, anything. Okay, got it? Then let's say we needed to trim the gums. There's another example of a tooth that has decay, and the decay is up underneath the gum line. So what we're going to do now is we're going to go ahead and trim just the gum tissue.
Is that red light like a marker?
That's the actual argon beam. That's actually a sighting tool. That's not the beam that's cutting. The rays or the wavelength is infrared, so it's invisible.
Right.
This is like an argon beam that you can actually see, so that the dentist knows where he's actually going. But look how we're actually trimming this gum tissue without one extravasiated red blood cell anywhere in sight. There's no bleeding involved here, which is really huge when you're doing dentistry, because the bleeding contaminates the area if you want to use materials to correct it. So we use it for one setting to do the gums, and we change the setting, and we'll go back and it'll start to do the decay on there too. So I think lasers are going to be a paradigm shift in dentistry. It's going to actually revolutionize the way we normally are familiar with doing dentistry. Patients are really driven by technology. They love it. So the patient's acceptance is really high.
What about insurance?
Insurance, we charge the same for our restorations using a laser. As we don't say this is a laser prepared tooth.
Right.
We just say we're going to charge X amount of dollars. The insurance company doesn't say have you used a laser or not.
Right.
I imagine someday they might even change that. But see, now I changed the setting, and now that same
looks
tooth
thicker.
that I trimmed the gums, now I can go back and
instead
of working on soft tissue, now I can remove hard tissue.
How do you change the setting? Like, what does it do?
It has that's a little complicated, but it has to do with the parameters on the actual units themselves. Hertz rate, micropulse duration.
Do you like increase the frequency?
Well, actually, the wavelength stays the same, but the frequency, that's right, the hertz rate changes.
Okay.
So you start to see different pulsing, different depth penetration. There's some physics involved with this. I mean, you have to become familiar with laser physics to really understand. But look how beautifully it cleans this up.
That's incredible.
Nice, huh? Yeah, that's pretty good.
And this is all done right here. So you still use water to cool the tooth?
Yeah, we use water because water, this particular wavelength is highly absorbed in water, which means instead of burning the teeth, the water picks up the energy, and all you do is remove just the part that you want without frying the teeth. You know, before the earlier lasers that you might read about in the journals that have been out for 20, 30 years, those were all thermal, very, very hot. And these are less thermal. They're still thermal, but they're approaching levels of what we call subablative tendency. So you don't get a lot of ablation techniques in here.
So is water being shut out from the tool?
From the tool to cool it down.
Okay.
But actually the part that's cutting is the actual laser beam. So the water is kind of like a cooling tool.
And that's the infrared?
It's infrared. It's at 2900. The wavelengths on these are between 2800 and 2900 microns.
What percentage of the patients still have to get numb?
I would say using lasers less than 20%.
Are you serious?
80%
Wow.
use no shot, no drill.
You always try without it?
I try without it first, yeah, because I can always get the patient to agree to that. I say, look, would you like me to try the laser, no shot, no drill? Yeah. But some where there's a lot of infection and the teeth are really hot, sometimes we still have to use anesthetics.
Wow.
Did that help you at all?
Yes, absolutely.
Cool, huh?
What if the laser...
You guys are getting into a field that's really, really changing. It's going to be changing for the better.
Yeah.
What if you hit the gums with the laser?
Well, you saw what happened over there, right? If the wavelength is the right wavelength, it'll actually, peel the gum away. But if the wavelength is only hard tissue, you can point it right at the gums and it won't have any effect. There's a property called chromophore. That's a property that you assign to a material what its absorptive value is. If it absorbs in dentin, it'll work. If it absorbs in enamel, it'll work. So you can take a laser and point it to a tooth on enamel and then hit the gingiva and it won't do anything. Or vice versa, you can take that laser, change the settings, point it at the gums, and you can go right around the gums and it won't hurt the tooth at all. That's the beauty of it.
So, I guess how would one after dental school be trained to use something like this? Is it just...
Well, you'd have to go, like most of us in the past have had to go to special continuing ed courses, special forums and symposiums that just house laser. Right. You're fortunate because in Arizona, at the Arizona School of Dentistry and Oral Health, I was the one who started the department of laser dentistry there.
Wow.
So they now have taken it to a whole nother level. But we're using lasers at the school. The students are learning how to use lasers, where other schools are just talking about it. But this is an actual school that really uses the laser. Wow. It doesn't turn around and say, it's an extra credit or only when you get all your requirements out.
Then we can talk.
These students here are required to learn it as part of their curriculum. Otherwise, I think it used to be they wouldn't graduate unless they passed that course.
Right.
So we're hoping to change the direction that laser dentistry is going, and that's what we're doing.
We actually